Hi, everyone. Welcome to the Concussion Discussions series brought to you by Integrated Brain Centers. I am your host, Amy Zellmer from Faces of TBI, and today I am here with Dr. Michael Lovich from Delta S Performance, and we're going to be talking all about recovering from concussion. So thank you so much for being here today.
Yeah, thank you. Thanks for having me.
Yeah, so in your chapter of the anthology, you have several like short stories talking about different recoveries that your patients have had. And the one thing that always strikes me is people who have been struggling for like a long time, like years, and then they are able to finally, get to functional neurology and have a remarkable recovery. So maybe let's start there. Like, whether you're 2 weeks out from your concussion or 20 years out, how are you able to like flesh that out and still help people?
And I'm actually like my personal story, which is on my website. I'm one of those people who were 25 years out that was able to get improvement from these brain rehabilitation techniques. It's That's the whole thing. We're not necessarily fixing a problem with the brain as much as we're taking the brain where it is right now and we're finding what that brain needs in order to improve from that point. Whether it's reducing symptoms or improving brain performance, they all work hand in hand. They're all different shades of gray, and we want to make sure that people understand that it's not so much, well, okay, well, it happened a year and a half ago, so can't really do anything about it. This is me now. Instead, it's the story or the narrative should be there. There's always hope.
Mm-hmm. Yeah. Yeah. And, and I think a lot of people hear that. I heard that at about the 1 year mark. My neurologist told me, well, this is probably the best you're going to get. And I mean, I'd had zero improvement. If anything, I was still declining at that point. And I was like, why didn't we do something in the last year? um, and unfortunately, people that, that's very outdated information that,
Yeah,
recovery only happens in the first year or two. And it's still getting passed on to patients.
that's the unfortunate part of this whole paradigm is when we're dealing with concussion and traumatic brain injury, it's more of a functional issue where people have varying levels of function. You can have an injury that really debilitates you, and you can have an injury that's just enough that it makes you different, but it doesn't look different to anybody else.
Mm-hmm.
So, and everybody's individual story, everybody's individual experience is completely and totally valid because the goal is for you as the individual to get better, not for you to fall within a certain metric or statistic of the average American person. That was what happened to me personally. I was slipping and I wasn't doing well for what I was, but I was still technically, according to average standard American metrics, about average or slightly above. So they're like, oh, you're fine. And I remember I went to an eye doctor once and I was like, I can't read like I used to. And I used to have a photographic memory and I used to be able to read relatively quickly and have very good comprehension. And then I went to an eye doctor because I was like reading these books, trying to learn. And I was said, something's wrong. I literally can't read. I have to read paragraphs over and over. Something's wrong here. And the eye doctor said to me, you're in grad school, right? I said, yeah. He's like, good, your eye should be tired.
Wow.
But we need to change the paradigm. We need to change the paradigm of let's find reasons why you should be okay with how you are right now, to accepting where you are now, giving yourself some slack, saying it's okay, I can be
Yeah.
like this, I don't need to be perfect right now, but what are the most appropriate steps for moving forward? What's our next first step? There's a meme that that keeps coming by my Facebook that's two ladders, one next to each other. One has a ton of little rungs next to each other, and one has a bunch of big rungs. With the tiny rungs, the guy's climbing up, and with the big rungs, the guy can't reach the first step because they made that bar way too far. Let's just cut ourselves some slack, get to the point of what's the small first step that we need to do and keep going.
Yep, baby steps.
Hmm.
And and sometimes you're going to go back a step or two on your recovery, and that's normal. It sucks. I definitely, I kept, when I finally got into functional neurology and I was getting better and better, and then like bam. And that was, I knew what it was. I did too much. I overdid it. I was like, "Oh, I'm feeling good. I can do 20 things today." Nope. And then fast forward 5 years, and now here I am. I can do 20 things in a day. Most days. I still have crummy days, but they're much fewer and far between.
Yeah, exactly. And if you were 5 years ago, if you can look at yourself and be like, I wish I could just be where you are now,
Hmm.
and you made it. But does that mean stop? No, it means, okay, if I can get here, where else can I go?
Hmm.
One thing I would like to bring up for those who are reading the anthology and looking at what we posted, this was not me, this was not all me. Three of our doctors, including myself,
Hmm.
um, wrote individual stories about our own experiences with patients, because we have a team approach here, and it's not the Dr. Lovich show by any means. It is the patient show. We're here to get the patients better. And so we actually, when we had this opportunity, and we were very grateful that you gave us the opportunity to write three separate ones instead of having to do one larger one, because it allowed us to spotlight many people in the practice.
Hmm. Yeah. Yeah. And, the team approach, and like you said, you guys are patient centered, right? Like it's all about getting the patient better. Um, and you have multiple locations as well. And not every, we were talking about this before we started recording, but not every funk neuro is equal, right? Like you all have your strengths, and some doctors are much better at treating dysautonomia or dizziness or balance. And that, I think, is what's cool about your practice, is you have all these providers, and so you have different people who specialize in different things, so you can really cater to what that patient specifically needs versus, a cookie cutter approach like you get in traditional rehab.
Yeah, we all have our special interests, but we all, one of the things that I take pride in is that we all have a minimal competency at our office that cross trains everybody. So no matter what walks into the office, any one of our doctors can help and make some improvement. We may have some more may have a doctor that spends all their time reading more about neurodevelopmental changes, or we have one of our doctors who is actually a close connection to her. It was one of the first cases of Lyme in America,
Mm,
and so she works and has seen a lot of patients who have concussion on top of Lyme disease,
yep.
which is, that's a whole nother that's a whole nother game there.
Yeah.
But she spends a lot of time reading those, and we have one who's been spending a lot of time reading about mechanical forces for motor vehicle injury and concussions, because those are slightly different than other types of concussions. And my personal thing that I like to read about is concussions, sports related concussions. And I've, but recently I've been getting on a little kick about dysautonomia,
Mm.
and that led to a kick about Alzheimer's and more neurodegenerative conditions, because you just keep reading, because the more you know, you may find that one little puzzle piece that helps the patient, and that's what it's all about, right?
Hmm. Yeah. And you mentioned the Alzheimer piece, and we've been told that we're something like 10 times more likely to develop Alzheimer or dementia after a concussion. Um, and that's really scary. Like,
Yeah.
especially early in my injury, like I got a glimpse of what it must feel like to have Alzheimer's. Like I couldn't remember freaking anything. Um, and I would get lost driving. I'd be like, "Where am I?" And I'm literally a block from home. Um, but what am I trying to say? Like, if we can help you get better now, that better protects you from those other symptoms down the road of dementia and Alzheimer's.
And with all the information coming out, there's a lot we don't know, but there is also a lot that we do know. And we have to trust that the data that's out there right now can at least give us guidance towards what we can do. So, like we talked about, those shades of gray, just because you have like a headache that started 4 months after a brain injury, is that a migraine isolated by itself, or is that a post-traumatic headache?
Hmm.
These are questions that have to be looked into because everything is all connected, and it doesn't necessarily mean, oh my god, if I like bumped my head 4 years ago, now that might tell me where I'm going. It's more like take things can have meaning,
Yeah.
and some things might not have meaning. They just might exist. And one of the things that we need to look into as a team, both with one of the doctors at our clinic and with the patient, is to put together the story and put together what may have meaning and try to find out what are the best steps to help improve your life. And that's actually why we named our clinic Delta S Performance, because it essentially means that all things in life are going to, if left alone, go to a state of disorder and dysfunction. And you need to put energy into it
Mhm.
in order for it to maintain order and function. So just because you're here now doesn't mean you're going to stay here. Every day we should think about what's one thing I can do that can improve our trajectory in life.
Hmm. Yeah. Yeah. And I guess that's kind of what I was trying to say is like, just because you have a brain injury doesn't mean dementia is like your ultimate sentence. There's things we can do to work on it and get better and protect our brain further. Um, yeah. So, yeah, I like that. Just every day we should be working on one thing. I like that a lot.
Of course.
So, what advice do you have for someone watching who maybe is, 10, 15 years out? I hear a lot from people, 20 years ago, we didn't know nearly what we know about concussions today. And maybe they had a car accident or sports injury or, kid got hit by a car on a bike and they never were told they had a brain injury, and then 10, 15 years later, they make all those connections like, oh, wow, I had a brain injury. That's why I struggle with XYZ now. So what advice do you have for someone like that who's listening? And, they've just lived with it for so long. But there's this reality that, we can help you.
First step is to read the anthology that you're putting out. It- in reality, it's good to read experiences of people who are like you, because you don't want to feel like you're alone on an island.
Hmm.
The second step is to get a circle of friends who are outside the community who can help understand, or at least are open to understanding what you're dealing with, because you need to have some sort of support group around you that is within the community of other people who know what you're dealing with and have experienced themselves, but also people who are outside the community, because you need to also be able to say, I've had patients come to me where they feel like they weren't getting better, though all their metrics were getting better. And it was mainly because they forgot what it felt like to not have their symptom.
Hmm.
And it was their symptom was so reduced. And then when it didn't, and then when it wasn't there, they didn't believe it. They thought something else was wrong with them. And
Right,
so it's good
right.
to have people that you know and trust around you who can help give you some sort of metric to be able to compare yourself to. Um, the next thing to do is, well, I just lost my train of thought. Pretty.
Welcome
The
to the
next thing to
TBI
do
world.
is to reach out and find somebody local in your area. You may notice that my clinic's system is set up a little bit differently than other functional neurology clinics. Many clinics, they have a lot of nice fancy toys and very nice fancy buildings. We are a little bit lower key than that. We have a bunch of offices with doctors who care, and we may not have all the fancy equipment, but what we will do is we're there to get a person better. The reason why we do it this way is because if you've ever had dizziness or vertigo as one of your symptoms, we'd like to be a little bit closer to where you live, so that way you don't have to drive 2, 3, 4, 5 hours or hop on a plane having the worst day of your life just getting to a place where you can have treatment. So my goal is to have a bunch of little clinics dotted around the country in areas where people need the care. And the next thing that you can do is you can reach out to me anytime. If you say, you know what, I'm looking for a practitioner who needs, I'm looking for a practitioner, I'm dealing with this. Do you know anybody in my area? One of the things that I find really important in today's world is networking. It's all about knowing is who you know and knowing who they are, how they work. And if anybody's looking for somebody, feel free to reach out to me. I will help you find a functional neurology provider that provides expert level care in your area or what the closest would be to you. Unfortunately, that might mean that they might not be in your backyard.
Yeah.
But the goal is for you to get the care that you need, or at least to get you in the right direction so you know it's money well spent.
Hmm. Yeah. And, I think it's really important to point out that there really aren't a lot of you guys out there. Um, I think you said there's like 800
I've
diplomates from the functional neurology, but of those 800, only about 30-40% actually focus on running a functional neurology practice and helping people with brain injury
30 of the people who claimed, so there were 800 worldwide that do
worldwide.
this. And of that 800, and this was back when when I read the statistics, there may be, I think there's about 100 or so more now, but 800 worldwide, 30% of them claim to do it full time,
Mm.
which means that if you go to their clinic, the likelihood that you're going to get true full-on functional neurology rehabilitation that doesn't have a bunch of different type of therapies elements mixed in, you're going to want to go to somebody who lives and breathes this stuff because they're going to be the best at it. And then of those people that do it, that claim to do it full time, there's definitely varying levels of expertise based on how long they've been in it or how much they've read or how many patients they've seen in this paradigm. And the good news is that there's a lot of people going into this. The bad news is that the amount of information you need to learn to get to this level to be able to help a person, it's a lot of info. I think it's a 3 years of studying after a doctorate degree
Yeah.
just to get to the bare minimum. And most people keep going after that. Like I did it while I was in chiropractic school. So I had a little bit of a shorter time, but then I've been studying for the past 5 years, learning more and more. And I'm way better now than I was 5 years ago, for sure. So there's the tough talk, which is there's a cost associated with that because insurance doesn't necessarily pay for
Yeah.
these therapies because they say, oh, you look at you, you're a chiropractor. If you're not adjusting, we're not going to pay. I hate that. I really hate that
Yeah. It's
because
very unfortunate.
that means patients can't use the insurance that they're already paying for or already have because I mean, at maybe not now, maybe in 40 years from now, I'll have a free clinic for people, for everybody. But right now, we can't. We got to keep the doors
Yeah.
open.
Yeah. You
So
pay for that equipment and the electricity.
exactly. So right now, if I can help a person find an expert level doctor in their area without having them to fly across the country to spend a week on a gamble, I am more than happy to do that.
Hmm. Yeah. Yeah. And, it's sort of like if you had something wrong with your foot and you went to just your general doctor, they could maybe help you. But, going to the podiatrist, he really knows how to help you. Like he understands that's all he does is treat the foot. And so that's kind of how I equate, people who practice functional neurology, like you said, at a full-time level, that's all they do. They have a way better understanding of functional neurology, right? Like, and I guess maybe let's just take a minute, like real briefly, like what is the difference, like traditional neurology, like you go see your neurologist, but then there's functional neurology. Like it's so vastly different. And I know that that can be a long conversation, but like Cliff Notes version.
So for the longer version, we actually had a podcast before on your
Mhm.
Facebook TBI podcast where we talked about this in depth.
Yep.
Cliff Notes version is neurology is a massive and huge field. This means that you can't be an expert at everything. Most people they have an area of specialization or area of expertise. If you go to your medical neurologist, they're going to be doing a very appropriate exam, looking for very serious conditions, things that are potentially life-threatening, things that are chronic and debilitating. They're also going to be looking for, do you fall within an appropriate diagnostic criteria? Do you fit inside the box so that way they can diagnose you with it? If you don't fit inside the box, there's no clinical justification, which means that in the paradigm that they are forced to work in by the insurance companies that
Yeah.
that allow them to work, they're going to be, they're only within a small window in which they can do it, which means that they're doing very necessary, very good work, but it's only going to handle here. There's still everything else. A functional neurologist is going to do a very similar examination. However, instead of in the medical paradigm, is it working, is it not working, positive or negative, and then we classify you, we're looking to see, when we do the same exact test that the medical neurologist does, how well is it working? And based off of how well it's working, we're going to be looking to say, okay, well, if they're all normal and these are all fine, instead of throwing them out, we're going to say, well, it was normal, but it was a little bit hyperactive or a little bit hypoactive. We're going to really dive into the details and figure out where in the brain the issue may lie. Because a bunch of positives, even though everything's normal, a bunch of things trending in one direction may be enough to make a symptom or decrease the quality of life. And that's the main thing we're looking for is in a functional neurology clinic. Mm-hmm. What is normal for you and what can be improved in order to make changes in your symptoms.
Mm-hmm. And if we go back to your example of insurance doesn't like to pay for you guys unless you're adjusting, it's similar with a neurologist. They're not going to pay for things unless it fits in that tiny little box. Right. So that's kind of, how, unfortunately, how things are driven in our healthcare world. I will say in the whole insurance part of it, a lot of insurance will reimburse patients a portion of their functional neurology fee. I have heard of people getting almost all of it back. I've heard of people getting half of it back. And then I've heard people, get like 20% back, which some is better than none. So definitely check with your insurance provider.
Yeah. So we provide super bills for any patient that requests one. The reason why is because, yes, we want people to be able to get care without money being an issue. Mm-hmm. So I've had patients get, the largest I've seen in the Boston area was 80% reimbursement for everything we did, which ended up being less than her copay, which was nice because she was able to get care that she needed, see improvement, but then it wasn't like taking a mortgage on her house, which would be terrible. So if you're going to see somebody who does functional neurology, ask for a super bill, ask for the diagnosis codes that you most likely will receive. They may not be able to tell you. They may say, we don't know what we're going to diagnose you with until we see you, which is totally fine. But you can at least ask for the most commonly used CPT codes and ask for those codes. Take those codes, go to your insurance company and say, hey, I'm going to see somebody out of network because I'm not able to find this in network. These are the codes they use. What kind of reimbursement can I expect? You might have to call 2 to 3 different people because sometimes you'll get somebody on the phone that actually does not know, but they're still going to give you an answer because that's their job.
Yeah.
But call up a couple times. The other thing that I've noticed is some people have been able to get out of network coverage under other practitioner benefits. I had one patient, and I've only had this once in all the patients I've seen, but she was able to basically talk to the insurance company and fight enough on her own behalf that they put it under her out of network physical therapy benefits.
Oh, interesting.
And that's a decision that the insurance company can make. But for some reason, I guess insurance companies are more interested in keeping you as their subscriber than they are as paying us as doctors, which makes sense. More money in.
Yeah. Thanks for sharing all that. That's great information. Because I know that's a big challenge in any of the alternative modalities that are out there that can actually help. So it's so unfortunate that that's how it has to work.
One thing
But
to know is the likelihood that nutrition and supplements are covered is very little. I would say if you're gonna expect something, try to limit it just to like the physical and neurological rehabilitation.
yeah, yeah, that's a really great point too. So, Dr. Lovich, thank you so much for being here today and sharing with everyone. All your information will be below this video. I will also try and get that podcast linked below here too, because that was a really good podcast. And if people want to find you, your website is deltasperformance.com. They can find you on Facebook and Instagram, Delta S Performance. And as you mentioned earlier, they can always give you a call and chat with you.
Anytime. Thank you.
Thanks for watching. I hope you enjoyed today's video. Be sure to hit that subscribe button so you don't miss any videos in this series. Like this video and head to Amazon to purchase Concussion Discussions.